Good morning and welcome to this month's SonoSim hosted webinar. I'm Heidi Winkowski, Vice President of Member Engagement and your moderator for today. And today we'll be reviewing musculoskeletal ultrasound-guided procedure training. All attendees will be in listen-only mode and may ask our panelists questions during and after the session in real time through the chat. A recorded version of this webinar will be available after our session. If you're just joining us, welcome. At this point, I'll introduce SonoSim Founder and CEO, Dr. Eric Savitsky, who will discuss the cognitive tasks training principles that underlie each SonoSim Procedure Training Module. Afterwards, our product manager, Eric Siryj, will give a detailed walkthrough of how to use a SonoSimulator to practice an ultrasound-guided MSK injection. So please stay tuned for that. Welcome, Dr. Savitsky.
Great. Thanks for the introduction, Heidi. Excited to be here with everyone and spending some time with everyone during this webinar to talk a little bit about our SonoSim procedure modules, and then most importantly, a little bit of the underlying principles, what we're trying to accomplish and what standards we're trying to adhere to. The context for this discussion is our SonoSim musculoskeletal training modules, and we have quite a few of them. We're going to focus on the items in orange, in particular our shoulder MSK injection and or aspiration modules, which cover the glenohumeral joint, the AC acromioclavicular joint, the bicipital tendon sheath, as well as the subacromial subdeltoid bursa. And for those of you that are new to SonoSim, there are some basic anatomy and physiology modules. There's 11 of them, and they are highlighted here on the screen. So for the most part, every joint in the body, there's an introductory anatomy and physiology module that takes you through the anatomy, physiology, regional anatomy, sonographic technique for scanning, and some imaging tips and pitfalls. We do have 2 core clinical modules that cover soft tissue and just overall introduction to musculoskeletal ultrasound, and these do introduce pathologies, and these all lead into what we're talking about today, which is the ultrasound-guided procedure modules. So a little bit more on the underlying construct. So what are the underlying principles that our procedure modules attempt to adhere to? And we drew these from the OSAUS criteria, so the Objective Structured Assessment of Ultrasound Skills. So these were a set of criteria that were consensus agreed upon, published in 2013, and some follow-up studies within the few years that followed. And essentially what they did is they used a Delphi consensus process, took subject matter experts across different ultrasound domains, and ultimately defined what does it take to become competent at a particular ultrasound application. So, understanding why you're doing the exam, understanding how the ultrasound machine operates, how to actually optimize the image and the image view that you are using, potentially to do an ultrasound-guided procedure, how to perform a systematic examination, how to interpret the images, how to document the exam, and then how do you actually take the images that you've acquired and interpreted and apply them towards medical decision-making or actual executing procedure. So these are the criteria that were agreed upon that define ultrasound competency, and the same criteria were used as checklists to actually assess how well people have developed ultrasound competency across different applications. So we've integrated this into every one of the modules, the procedure modules, and we'll get into that in greater detail shortly. So assuming you've bought into this and you're in agreement, you actually want to execute this, there's all the traditional barriers that all of you are familiar with if you're engaged in ultrasound education, which is needing a machine, an instructor, a student, a patient with pathology, a teaching moment, the ability to repeat until you achieve mastery, and then the resources to assess whether people have achieved competency using some of the criteria that were aforementioned, and then providing an opportunity for refresher training to avoid skill decay. And this becomes really important with ultrasound-guided procedures, in particular if you haven't done one for a period of weeks or months, and then all of a sudden you have a patient in front of you who would potentially benefit from that procedure. So all of these are the historical barriers that have held back ultrasound. A lot of what SonoSim's done, it's created different pillars that underlie the SonoSim platform, and they are all designed to overcome all of the aforementioned historical barriers. So online courses created by subject matter experts from different domains, the ability to scan real patient cases using the SonoSimulator. And this teaches you the image acquisition and image interpretation ability. And then basically being able to perform your procedure and have it tracked using some AI advanced technologies. And this is all integrated within our SonoSim Performance Tracker system, which also tracks mastery of the course content. SonoSim LiveScan with Case Builder was created to help you understand how to apply ultrasound images that you've acquired and interpreted towards medical decision-making. This will be less emphasized in today's discussion. And then what we're really focused on today is ultrasound-guided procedure training. All right, so digging in. So what you see here is several screenshots, and these are screenshots from our ultrasound-guided MSK, in particular shoulder, modules. And what our modules provide is they provide declarative knowledge. So the courses, once again, online courses, accessible through any mobile platform as well, provide you the declarative knowledge, the didactic background knowledge, understanding of the regional anatomy and the different techniques that are required to execute the procedure. So this is the declarative knowledge. And this is coupled with teaching you and creating an environment that someone can acquire procedural knowledge and really understanding how to navigate different anatomical variations. One of the unique things of how SonoSim creates content is it uses real patient ultrasound data. So you get exposed to a variety of different pathologies, as well as different body habitus types. So it really, really trains you using real ultrasound data as opposed to computer graphic imagery and alternative techniques that are used for procedure training. And then most importantly, it actually teaches you the psychomotor skills. So specifically the visuospatial and the visiomotor skills. So the ability to really understand a three-dimensional environment by moving a 2D probe and using 2D slices to reconstruct an environment. And then importantly, guiding a needle tip, whether it's in plane, out of plane, or a combination of those two towards your intended target. And you can develop a really good foundation of this within the SonoSimulator using our procedure modules. And then we've also created an accompanying mobile application that allows you just in time at the bedside, really, really easy reference tool. And the mobile app allows you to get, just immediate images that can help you remember what certain landmarks are. There's key concepts that could be reviewed, and you could, for all intents and purposes, take the entire course using the mobile app, should you desire. So these are the multiple components that are included in every one of the SonoSim modules, specifically the MSK modules of the shoulder. Diving in a little bit deeper, in terms of how your declarative knowledge is attained and delivered, it's delivered in a very standardized way to where, irrespective of what the ultrasound-guided shoulder procedure is, the process through which we develop your knowledge is very, very structured. So you get an introduction, so you understand, why you're doing the procedures. You learn the anatomy, regional anatomy, as well as relevant physiology. You are taught the sonographic anatomy and the sonographic technique for imaging. You get information on procedure preparation, as well as procedure steps. There's a review of procedure tips and pitfalls, as well as procedural complications and how to best manage those. And then the course closes with a summary of closing concepts, and then there's a mastery test, which if you achieve 75% or greater, you get credit. And this is all tracked within SonoSim Performance Tracker. And then once again, how you develop your procedural knowledge and your psychomotor skill, that is through the SonoSimulator by loading real patient cases and performing procedures using the ultrasound probe held in one hand, and then manipulating a virtual needle in the other, and using your image acquisition to guide the needle to its ultimate target. And importantly, you'll get immediate feedback on whether the procedure was done correctly or incorrectly. And once again, just an important distinction. So you're manipulating the probe in one hand, so that's helping you acquire the image view. You select the image window and different approaches, whether the anterior or posterior, and then you use your keypad, your up, down, right, left arrows to help navigate the needle. And you can move the probe within a fixed geographic space, once again, using the keyboard, but the fine motor movements are the same movements that you would use to orient your transducer to acquire the optimal view. And then it helps you really develop that visuospatial ability and as well as the visuomotor ability to drive your needle to its intended target. So this creates a really, really good foundation that can be subsequently built on. And whether it's with part task or full task trainers or even mentorship on real patients, when you get to that level of additional practice and learning, you have a really solid foundation of pre-training that you've acquired through the SonoSim products. A little bit on the ability to provide immediate feedback to learners. So one of the things that we've built into the product is the ability to provide users immediate feedback in terms of coaching, mentoring, and feedback if they've correctly performed the procedure. And when we did this, we didn't do this lightly. There was years and significant resources put into really dive into the psychometrics of ultrasound-guided procedure performance, looking at the metrics that define competency, as well as really looking at how can we integrate this in a way that individual users would be able to benefit from this. Some of the data and some of the prior studies that helped fuel and serve as the underlying architecture and logic for our performance tracking feature is we looked at psychomotor skills, and interestingly enough, we found people have psychomotor traits. So some people have better psychomotor traits intrinsically than others, but for the most part, psychomotor skills could be trained. As you age, psychomotor skills do decay across all domains. Ultrasound is no different, but with appropriate training, you can maintain and even build your psychomotor skills with repetitive practice. The other thing that we looked at is what would be the metrics for success or failure. And we looked at a variety of different procedures, everything from fetal biometry to ultrasound-guided procedures, which require higher levels of procedural knowledge and skill. And we were able to tease out the metrics that really, really help define competency. And those are what are included in the product and in Performance Tracker and in the modules. The musculoskeletal shoulder modules have built in feedback leveraging our expert-based AI system. So once again, you'll be able to get the declarative knowledge through the courses. You'll be able to get the procedural knowledge as well as learning the different anatomical variation, as well as starting to develop the foundational visuomotor and visuospatial skills to be successful when you do perform ultrasound-guided musculoskeletal shoulder injections. The metrics that we use are validated, and those are the ones that provide you immediate feedback. And then once again, you have a virtual tutor that will take you through the modules. You get instant feedback as soon as you've executed a procedure. My colleague Eric Siryj will get into that in greater detail. But for all intents and purposes, the SonoSim MSK series and the first joint of the series to be released, which is what we're talking about today, is the shoulder series. Once again, covering subacromial subdeltoid bursa, bicipital tendon sheath injection, acromioclavicular joint, as well as glenohumeral joint injection is and has been the focus of the discussion today. So with that, I'm going to turn it over to my colleague, Eric Siryj, who'll do a deeper dive into the actual product and some of the features and the applications. Thank you.
Hello, everyone. My name is Eric Siryj. I'm a product manager here at SonoSim, and I'm going to be going a little more into depth in the SonoSimulator, showing you how you can practice these MSK procedures that we've been talking about. As was mentioned, right now we have 4 MSK procedures focused on the shoulder, and we're going to be going through the other major joints of the body as we go along this year. So just want to give everyone an overview of the SonoSimulator if you're new to the product. So along this tab here, these are your image windows. They allow you to select the procedure that you're trying to do. So if you want to do a survey scan of the posterior glenohumeral joint, you just click here, and then this window is going to give you your tasking. And then this next window is going to be the posterior lateral approach. So if you activate that, it's going to give you the ability to do the procedure. And then if you wanted to do a posterior medial approach, you would activate that by clicking this window. And so the navigation between the various image windows is through this bar down here. And so once we've selected this, we're going to do a survey scan. I just want to show you the tools that you have available. So case history here, this is going to give you your tasking. You can use this button to change the position of the patient. The layers button here is really helpful. It's going to allow you to explore the anatomy. As I'm scanning through the glenohumeral joint, I can see the humeral head here. I can see the labrum. I can see the glenoid, and I can start to develop an appreciation between the probe indicator and the indicator on the screen. And as you can see, I'm holding the probe here in my hand and making fine movements, and those movements are being emulated by the virtual probe. The probe guide is a really important feature. If you do not know how to get the transverse view, I can click here on transverse, and there a virtual probe appears. And so I can align the probe that I have in my hand with the virtual probe on the screen and get that transverse view that I want. And that's really important because once you get this expert view, that's going to correlate to our anatomy guide here. You could take away that guide here with this button, or you can have it on, and here you just have the anatomy guide available to you. And so here I'm going to use a transverse approach. I'm going to use a posterior lateral to posterior medial approach. And then I'm going to be coming in from this area on the skin. And that's going to result in a needle trajectory that's hopefully going to enter into the glenohumeral joint, avoiding the hyperechoic glenoid labrum, and then avoiding to the hypoechoic hyoid cartilage. So now that I'm ready to do the procedure, I'm going to hit my procedure mode and get my tasking. And then I'm going to activate my needle. And here I'm just going to hold the image view that I would like. And then this is it right here. If I want to change my depth, I can change my depth markers. But at this point, this is a good magnification. And then I can also optimize my gain here. All of my controls on how to move my needle are displayed here in this legend. And then there's tasking right here, asking me to align the probe and needle over my target. And so I'm going to move my needle using the arrow keys. I'm going to go in plane. So I'm going to go right here to the center of the probe and then line my needle right up against the footprint of the probe. Once I hit enter, I'll be able to change the angle of the needle. I'm going to select 50 degrees, and now I'm happy with the orientation of my needle and my probe. So 90 degrees would be straight down this way, 45 degrees would put me about here. I'm going to go a little exaggerated though. I'm actually going to go a little higher here, let's say 53. And so I'm going to be expecting my needle to come down this way on the image. And so now I've hit enter, and now I can advance that needle. And I can see some soft tissue deformation right here. And so that means I'm pretty close. I'm going to make a small little manipulation of the probe. And this is a steep angle, so I'm not going to see the needle super clear, but I can see enough. And then so here I'm just guiding it to the target, watching the needle tip. So far, so good. Looks like I'm right up against the hyoid cartilage. Hopefully I am good there. Then entering the joint space and just really happy with this placement here. And now I'm here in the joint space, really happy with that positioning. And then just for instructional purposes, I'm going to go ahead and lock my probe so I can put my probe down and then talk a little bit about this positioning for instructional purposes. I can see that the needle has entered the glenohumeral joint. I've avoided the labrum. I've avoided the hyaline cartilage. And this is a normal patient. This is real anatomy. So if this patient had an effusion, there would be a much larger target area here. So in some ways, this is more challenging, but we are allowing you to really appreciate that normal anatomy here. So now I will go ahead and unlock my probe. And then I'm going to go ahead and hit Enter to inject. And when I inject, I get immediate feedback that says I successfully performed the procedure. And so I'm going to try again, and now I'm going to, on purpose, perform this procedure unsuccessfully. And here I'm going to use a posterior medial approach. So just going to find my landmarks here. And using this approach, I'm going to expect my needle to be coming in from this angle here. Then we're going to go through the deltoid, going to go through the infraspinatus, and then hopefully the needle enters through this trajectory. And so I've selected my needle. I'm going to again position it using the arrow keys. Going to go with in-plane guidance here. And looks like I'm aligned. I'm going to move right up against the base here. And I'm going to set my needle angle again. Going to go with a more graduated angle this time. I hit enter, and now I'm going to go ahead and start advancing my needle. And so I should see here the needle, as I'm advancing, start to enter on the right side of the screen. And there it is. And again, this is a smaller needle, relatively steep angle, so it's a little bit of a challenge to localize, but here it is. And I can see it advancing. Here I'm going through the deltoid muscle, and penetrating the infraspinatus muscle right here. And then here I'm going to inject. And so here the AI was able to track all of my movements, and it tells me this was an unsuccessful attempt. I was superficial to the glenohumeral joint, and I was positioned within the infraspinatus muscle. So here I'm getting that immediate feedback. I can go ahead and try again if I want. And so maybe I wasn't sure quite what I saw, so I'm going to go ahead and use the findings video.
On this image, the needle will come medial to lateral, the tip being parked in between the humeral head with its hyaline cartilage and the echogenic fibrocartilage of the posterior glenoid labrum. So this is the trajectory of the needle we will take.
And so here you get your expert tutorial of the idealized approach, the idealized technique. And then I can go ahead and try again. Well, I hope that was helpful for you. I'm going to go ahead and pass it back to Heidi to facilitate some questions. So thank you so much.